Hello and welcome along to another episode of Manx Radio's Newscast, an opportunity to hear the topics we cover in a bit more depth than what you'll typically hear on the breakfast show, Man in Line Update or the hourly bulletins. Now, the British Medical Association has released what it describes as sobering results from a survey of doctors, revealing a lack of confidence in management, low morale and a poor culture. This is the third year the BMA has run its Culture of Care Barometer survey, and consistent with previous years, it's highlighting some fairly bleak findings. So I sat down with the BMA to analyse them in a bit more detail.
I'm Prakash Thiagarajan. I'm a consultant pediatrician and neonatologist, but I'm here in my capacity as chair of the local negotiating committee of the British Medical Association.
First of all, we'll just start with reflections on the survey. What's your take on the survey results?
The survey results are deeply concerning. They indicate the organization's culture, which is not healthy, and therefore it is rather worrying. Doctors, on the whole, appear to feel unhappy, disenfranchised, not being listened to. And there is good evidence that the worse the prevailing culture is, the more it can have an adverse effect on patient care. And therefore, it is deeply concerning.
The BMA has described the results of the surveys as sobering and has been aware of these issues for years. So what has the BMA done in that time to address the culture of what is described as poor leadership and a lack of resources at Manx Care?
Yes, you're right. The previous year's surveys weren't much better either. And we have tried our best to engage with senior management, and we've come up with many constructive ideas on how to improve the culture. And unfortunately, not much has materialized for people to actually see and experience. And obviously, we've got much work to do.
So why hasn't the situation improved? Is it because of a lack of listening from the senior leadership? You said that you've presented ideas. Are they not being listened to? Are they not being actioned quick enough? What's the situation like?
The senior management appeared to listen. However, there are not sufficient actions that follow. And from the board, there is a perception that there is a disconnect between Manx Care board and not just Manx Care doctors, but the Manx people. I don't know how justified that perception is, but it's there.
Repeated surveys show the ongoing dissatisfaction among doctors with little progress year on year, like you said. Do you think that the BMA's advocacy on the Isle of Man is effective enough?
I think it's actually making people sit up and take notice. And I would hope that action will follow this time. But then I'm an eternal optimist. Time will tell.
Could it be said that the BMA is failing doctors by not achieving meaningful change?
It's BMA on its own can't really achieve any change. It's like clapping, you need both hands. And one hand can't clap. Therefore, we need full engagement from the Manx Care board and the government. Because, at the end of the day, we are here to provide the best possible service to the people of the Isle of Man. And we have to work together. We can only do this with full cooperation of the Manx Care board and management.
The surveys highlight a persistent culture of poor senior leadership and respect within Manx Care. So what power does the BMA have to enforce changes if leadership is failing to act?
Obviously, constant advocacy, empowering membership to speak up, There is always in the background sort of almost like nuclear options of industrial action, votes of confidence, etc. But those options invariably lead to a soaring of relationships for years and years to come and won't be undertaken lightly.
A vote of no confidence would be symbolic, though, wouldn't it? It wouldn't actually
Correct.
have any bearing on the board.
Correct, yeah.
Only 17% of doctors are proud to work for Manx Care and fewer than 10% feel listened to by the board. That suggests a serious disconnect. Does the BMA believe that incremental changes are enough, or is it more radical restructuring of Manx Care's leadership needed?
We believe that there has to be a radical restructure of leadership, and it has to be genuinely professional-led or medical-led. We're not just saying that because BMA is an association of doctors. There is very good worldwide published evidence that healthcare systems led by doctors and physicians have much better patient outcomes, patient safety, and are significantly more cost effective than care organizations led by non-doctors.
Doctors have expressed concerns about their line managers' behaviour, with over a third saying that they're not treated with respect. Has the BMA considered recommending legal action, or even, like you said, the nuclear option of industrial action as a means to challenge that ongoing culture of disrespect?
No, we haven't thought of sort of actions like that. As far as possible, we like to resolve, because we want to focus on caring for our patients. We don't want to be in constant situation of conflict. And we, as far as possible, try and avoid that. But clearly, our strategy of constant engagement and negotiation is probably not bearing fruit like it should.
So does that mean that a more tough stance should be taken? Because obviously this is the third year that this survey's been done, and it's been fairly consistent results across the board. So at what point will the BMA say, actually, what we're doing is clearly not good enough, we need to do something else?
It's when obviously we need to talk to our membership and decide whether we sit quietly and accept the current state of affairs, which is not healthy for staff nor patients, or are we going to take it up a notch? But again, that direction has to come from the membership.
We'll move on to resources and workload. 67% of doctors say they lack the resources to do a good job. 80% say they don't have enough time to do their work well. How does the BMA plan to ensure that Manx Care addresses these issues, especially in light of the ongoing financial pressures, which I'm sure you must be aware of?
It may sound like an initial expenditure, appointing appropriate number of staff members, but in the long run, that actually saves much, much money. Say, if we had the same number of staff as per the Royal College's in England guidelines, our waiting list probably would have never got to the stage that they did last year, where we had to spend something like 28 million to bring in an external company to clear. And with an initial investment of a few hundred thousands, we potentially could have avoided that. So it may seem like an initial increased expense getting the right number of staff, but in the long run, and as you know, safer healthcare is cheaper healthcare in the long run.
Let's just go back to the right number of staff you said. We know that recruitment is a big challenge. Even if they did have the budget to bring in more doctors and fulfill what you're saying is the right level of staff, that won't be a quick fix though, will it?
It won't be a quick fix, but it can be a relatively medium-term fix. And would be a good investment, what we like to say, call spend to save. And it'll be a good thing to do overall, to be able to provide. And you're likely to attract more people also. If you have a healthy culture that listens to its staff members, listens to their patients, and actually act on the feedback, because it's no good just listening if you don't actually act on it. And that would improve the culture and the reputation of the organization, which will eventually make the recruitment better.
Now, we know that Manx Care has cited financial challenges, including a savings target of £20 million this year. How is the BMA engaging with both Manx Care and the Isle of Man government to make sure that doctors' working conditions are not continually compromised by the budgetary constraints?
We try to speak to the Manx Care. We regularly try and meet with members of the board, chief executive, in various different forums. And at that time, we get listened to. But if you look at the actions that flow, that's probably been lacking. The Isle of Man Medical Society, which is the professional arm of the BMA, has actually got together and put a whole set of recommendations of how we can make Manx Care a highly functional, cost-effective organization.
And what's the proposed cost to action all of those points?
Initial costs may be probably what the Manx Care board costs per year, which is over 3 million.
Now, given the ongoing dispute over pay and the offer of a 6% increase last year, what does the BMA view as a fair settlement?
We put in a claim of 12.6%. We're still talking about 23-24. And we wanted an acknowledgement of commitment to pay restoration, like in the UK. And most of UK jurisdictions have settled their pay disputes. And for that reason, a junior doctor or a specialist doctor wanting to move to the Isle of Man will be significantly disadvantaged pay-wise as things stand.
But does the BMI understand that obviously the UK government has a treasury which has an expenditure of about £1 trillion a year? We have 300 million a year on healthcare.
Yes, but per capita, our spend on health and social care is one of the highest in the British Isles. Our concern is it's probably not being spent in the most appropriate areas.
Manx Care says it's made significant progress on reducing the amount of bank and agency staff. Do you think that's the case?
Yes, I think at least agency staff, they have made significant improvement. And we have many less agency staff than we had, say, 3 years ago.
Now, after 3 years of surveying, there seems to be little measurable progress. So what are the specific measurable outcomes that the BMA is expecting from Manx Care to address these issues? And what deadlines have you actually set for them to actually see real change?
We haven't set any deadlines. The power balance is such that we don't believe we are in a position to set deadlines. What we did after the last year's survey was to have detailed conversations with many, many doctors. And we produced a document called What Do Doctors Want? And it was quite a detailed one. And it was at that time received positively, and we hoped would lead to some real action. But unfortunately, so far, it hasn't. Again, the main themes were being listened to, being included in the actual day-to-day decisions, obviously being paid better, at least on par with adjacent jurisdictions. I can share that document with you later.
I know that you just said that you're not, or the BMA is not in a position to set deadlines. Does that mean that the BMA has a lack of confidence in its own abilities?
That's a good question. Obviously, I need to ask the BMA headquarters, to answer that question. But on the ground, colleagues are getting, what's the expression I'm looking for, fed up, waiting for positive change to happen. So again, we will be consulting with colleagues to say where should we take this, and seeking guidance from BMA headquarters.
If these issues persist over the next year, what actions will the BMA take to ensure that doctors' concerns are not continually ignored? What point, is there a point at which the BMA would recommend doctors withdraw services or escalate matters further?
There might be. But I do hope we never reach there. Sincerely hope, but it may happen.
With Manx Care acknowledging unpalatable and difficult decisions, do you believe that austerity-driven policies within healthcare are undermining doctors' ability to provide quality care?
Yes, particularly when austerity appears to be applied very selectively. In my view, and view of many of my colleagues, austerity should not be applied to any measure that affects patient care. I mean, that's the fundamental reason we are here. But austerity everywhere, perhaps layers of management.
Let's talk about that, actually, because doctors are well paid. It's widely recognised that they are well paid. Do they have support staff?
Not as much as they used to be pre-Manx Care.
But there's still support staff?
Yes.
And if we are looking at reducing patient-facing austerity measures, would it be an idea to cut back on the number of support staff that doctors have?
Not at the lower levels, but at the higher levels, yes.
What do you mean by the higher levels?
Because it's already cut to the bone at the lower levels. Like when I first joined here in 2005, I had a named full-time secretary. Now between 7 of us, we share 2. There is no more meat to cut at that level. But at higher levels, if you look at the number of managers, team leaders, etc., it is our view that there are savings to be made there. Obviously, they may not agree, but we do believe that.
Some doctors have raised concerns the Manx Care system is structurally flawed and needs reform beyond the leadership level. Is the BMA willing to push for a systemic overhaul of Manx Care's organisational structure?
Again, the doctors are coming to that stage, but we ought to convince the BMA to actually move that way. We've actually provided the government from the Alama Medical Society with our roadmap, and we're very willing to work. Again, unlike previous reviews that cost over $1 million, I think, this was done entirely voluntarily in our spare time. And we are willing to actually even operationalize those plans. They're very high-level plans. And we are waiting with open arms.
One last question. You said last year when the survey was released that you would be, you were quoted as saying that you would be having open and transparent discussions to deliver positive change. And with the release of this survey, in some cases, it's got worse. So it's not entirely on Manx Care, is it? Do you acknowledge that?
Yes. I mean, when we say we have failed to deliver change, that's both sides of the table. Yes, you're correct.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.